Hi, I'm Dr. Rudy Kasha, and if you're watching this video, then you're either considering or set up to see me for liposuction. So hopefully this video will give you a bunch of information that will help you in that process as you make a decision to see what's right for you. So liposuction is a great procedure, but it's a procedure that is very important to be applied appropriately. If not applied appropriately to the right patient in the right way, it either can cause some side effects that you don't like contour irregularity or skin looseness, or it just doesn't do enough for you that warrants the investment financially that you made. So it's a very important procedure to really talk with your surgeon, which potentially in this case could be me, but us talking about it and deciding what's going on, what your goals are, and really kind of formulating a plan for you. So with liposuction, basically what it is it's using cannulas. They're kind of like long, thick needles that are blunt at the end is kind of how you can think of it. And there's various sizes and diameters of them according to what we're doing and what part of the body we're working on. We can do liposuction anywhere, basically. So the arms, the chest, the stomach, the love handles, the waistline, around the hips, the thighs, all of that can be liposuction. Even sometimes the back of the neck up here, and even underneath here, the submental area, that works great. I had that myself. Well, to be honest, I had it through all here too. So here, I loved it. Made a huge difference. So personal patient story, but works great. So through those with those cannulas, we make little incisions that are about a little less than a centimeter, so that's maybe a little over 1/4 of an inch in length. And so through those incisions, put in locations where you don't see them, with clothing and underwear and bikinis and that kind of thing, we take out fatty tissue. So first we inject a watery fluid called tumescent solution that's got numbing medicine and it's got epinephrine, which constricts blood vessels so you don't bleed as much. We inject that in, that puffs up the area, deals with those other issues, and then we liposuction that out. Basically, full surgery, but very straightforward is kind of the way to think of it. So you're still under general anesthesia with a board-certified anesthesiologist. Occasionally, if it's some spotty small areas, we'll do this under sedation. And even occasionally, if we're doing a little touch-up or something like that, that's done even in the clinic, just with some local anesthetic. But through that, you're dealt with whether we're turning you over, all of those sorts of things, because a lot of times it's a lot of repositioning to get to all of these spots. But done in our surgery center, typically, like I said, under general anesthesia. The timing varies exactly from whatever we're doing to 30 minutes to several hours, just depending on how many areas we're addressing. Some key things to know with this. So it's patient selection. So there's lots of criteria, and we'll talk about this in person, but we don't want to take too much out because the skin can't contract back, and then it'll be loose. We also want to evaluate what this current skin condition is like. If you're young, not had kids, really taut, tight skin, we can be more aggressive than in someone that's older, maybe not so good genetics, possibly having had kids before, especially around the abdominal area and how that skin gets stretched out a little bit. All of those things limit what we can do, because then if we take too much fatty tissue out, even maybe the amount you want out, then it can leave you with irregularities in the skin. So that's something that's important to know as we really kind of tailor that in, and that will dictate the result that you get as well. Typically, the percentages of amount of fat, it really varies from person to person, and then all those attributes. Another thing that's asked about a lot of times is Coolsculpting. Coolsculpting definitely works. We have a couple Coolsculpting machines at our office. I think that's best used for localized areas and for people that just really don't want surgery. Coolsculpting will remove about 20% of the fatty tissue in that area, whereas liposuction, under good conditions, can remove a lot more than that. So it really depends on what your situation is and what your goals are, and whether you're okay with the idea of surgery or not. So that kind of plays all into that. Also, another question that people ask us about are BBLs, or Brazilian butt lifts. So it's definitely a common thing now. And the speech that I basically give all the time is this: your biggest result is coming from the liposuction. So everything is relative to something else. So if this is big, or let's say it's this size, this item is this big, we can either make this bigger by making it bigger, or we can make what's above and below it smaller, and then in relative proportions, this gets bigger. So that's really the concept with liposuction, and BBL. Your butt is getting a better shape by taking your waistline in and contouring your hips above and below it, so that your butt then gets this really nice shape. And I would suggest that the majority of our results from BBLs are from liposuction alone. And then you get a little added improvement with the fat that's injected back in from the BBL portion. That's where we collect the fat, process it, and then re-inject it into the buttocks to help with some kind of divots, so to speak, or just giving a little bit more fullness. So with that, have the surgery, takes several hours, whatever it is that's going on, spend some time in the recovery room. You go home, usually come back and see me about 1 to 2 days later. You'll have a compression garment on. You'll ooze some watery fluid that night. That's that tumescent fluid that I injected in. That's that first night. We'll get you walking around because we want to reduce the risk of blood clots, so DVTs or PEs. So we'll give you a kind of a walking schedule as well. And then we'll check on everything. You'll shower the day afterwards is fine. If it's just straight liposuction, it's actually pretty easy. So for me, when I had it, I was sore. But to be honest, I was scared to death of constipation, so I didn't hardly take any pain medicine. I think the first night I had one pain pill and I cut it into thirds because I was just terrified of that. I had a bad trip to Ecuador one time, so it scared me. So I still had some PTSD from that and did not want that to happen. So I tolerated it with very little pain medicine at all. Everybody's experience is different, but it's definitely sore. But it's something where you can definitely tolerate it. There's really not much restrictions. I don't want you getting your blood pressure up the first week or two because I don't want you bleeding. But if, a couple weeks afterwards you want to go work out and do whatever you want, totally fine. You're not going to hurt anything with liposuction, so it's not like a tummy tuck or something like that. With the BBL portion, if that were to be something, then we don't let you sit or lie or anything. No pressure on your butt or the side of your butt for the first week, and then very minimal the second week. A little bit less minimal the third week, and then after that, you're fine. So we kind of gradually get off that. So you do have some restrictions. You can only sleep on your front. You have to stand or kneel, that kind of thing, not really spending any time in the car. So all of those things, because we don't want to put pressure on the fat that we just injected, because that can cause more fat to die. So that's something to know with that. With everything, there's risks. So just like any surgical risk, there's bleeding risk, infection risks, like we talked about, contour irregularities, skin laxity, DVTs or PEs, those blood clots, or even very, very rarely the fat embolization, that sort of thing. There's risk of the fat. If it was a BBL, then the fat could die, plus infection. Those are always chances. That's why we have certain techniques to try to avoid that and get you the best results. So there's a whole bunch of paperwork you're going to read that has all of that overly spelled out even, so make sure you address that as well. But overall, great procedures. When used correctly, I'm a testament to that. I loved it. It was awesome. So those are things we'd be talking about specifically when we do the physical exam in your consultation, kind of go through all of that stuff, make sure I answer all your questions, and then we'll go through there. So hopefully that helped, and I look forward to meeting you.